Today, we have a pleasure to interview Mr. Ivan Bulkarsi. Good afternoon.
Good afternoon.
Mr. Ivan Bulkarsi is a Director of Clinical Education and Professional Services at the Nasal Airway Technology of company called Renomed. And he worked closely with the sleep physicians and clinicians in all aspects, in all specialties who wish to treat nasal obstructions and educate their patients on the importance of nasal breathing and its impact on good quality of sleep. And I feel very fortunate that I met Mr. Bulkarsi on one of the sleep conferences, and he actually, he has that wonderful product, which I would say a little bit of a missing link in the treatment of obstructive sleep apnea, because that helps for people to breathe better with the nose. And I usually ask the story how how my guests become passionate about this career, but this time I'm going to be a little bit different. I would like to ask you, Mr. Bulkarsi, what do you think about nasal breathing versus mouth breathing? Because some physicians feel it's the same, as long as you breathe. Please educate us about that topic.
Well, thank you very much, Dr. Sokolina, for inviting me. I really appreciate this opportunity to speak on the subject, because it's a subject that I'm very passionate about. And quite frankly, it makes a lot of difference how we breathe. Many people think that as long as you're getting air, it doesn't matter through which, which orifice you're getting air, as long as you're putting air into your lungs. But no, our bodies were actually designed to breathe via the nose, to deliver oxygen to the lungs through the nose. And the way we breathe is important too. There's a lot of work. You can find a lot of books now and a lot of research on, and there's a lot of therapists now who are teaching people how to breathe. Because what we want to do is we want to do sort of belly breathing, which is taking breaths that get air all the way down to the bottom of the lungs. And people believe that the best way to do that is through their mouth, because they feel they can get more air that way. But in reality, mouth breathing leads to chest breathing, and people sort of just, when you see your chest moving up and down like that, air's not really getting to the bottom. We actually have to maybe let go a little of the vanity and have our bellies extend. Because I know myself, when I feel I've gained a little weight, sometimes I don't realize it, but I start sucking in my stomach, and I can feel that I'm breathing a little different. So we have to let go of the vanity and let our bellies extend, push air through the nose into the lungs.
Well, this is wonderful. This is such a great explanation. And I noticed with a lot of people who breathe through the mouth, they get sick more often, and also they so much more anxious. Like the level of anxiety is much higher. It was my personal observation. Then, I connected with the science, and I realized that, of course, when you breathe through the chest, you activate your sympathetic nervous system, and it's a fight or flight response. But when you breathe with the belly, you really get proper breathing and a full relaxation for everyday routine. And that's why I always say it's so simple, but nose is for breathing and mouth is for eating. And it's very hard to change. I totally understand that. But I think if, with your company, with the education you provide to the physicians, and we can bring that idea to the world, the world would be the better place. I would like to know personally about you, how you came into this world of sleep medicine, or, nasal breathing, or basically Renomed. Please tell us your story.
So I've worked with healthcare companies for about 22 years now. And prior to this job, I was working actually with a diagnostic lab that had some esoteric tests, blood tests, where we tested ultra high sensitivity, at an highly sensitive level, some inflammatory markers. And that taught me all about stresses, because we dealt a lot with apnea, or with people whose stress markers went up. And a lot of times it was because of apnea and other things. So that's where I learned about the intrathoracic pressure and the stress it can put on the heart, and how people's blood pressures can go up, and how their high sensitivity troponin and other things can actually change because they're not breathing well, and particularly when they sleep, and then they're not sleeping well, and all of this leads to stress and inflammation and long-term chronic disease. But then one of my colleagues who was working for that company came over to Renomed, and then I heard that they had an opportunity for this clinical liaison education position, and I wanted to come over because I'm passionate about this subject of inflammation and breathing and snoring cessation, and we just have a really big problem in this country with people not being able to sleep properly and not understanding how serious that problem is.
Oh, I think it's so wonderful to have people who, from industry standpoint, support this area, because it's not enough to just have educated physicians. I think it's very important of support from the industry and people so knowledgeable like you. It's really a pleasure. Thank you very much, Ivan. And now I'm going to ask you really, fashionable question. Recently, with the COVID time, I learned a new term called nasal hygiene. As a dentist, being a dentist for so many years, we're so used to teaching, educating our patients about oral hygiene. You brush your teeth twice a day after the breakfast and before you go to bed, and you floss every day, and you rinse and you brush your tongue because you don't want the bacteria to multiply. But people overlook the nasal hygiene.
Correct.
And it's not less important. And, that's one of the positive things about COVID. People start looking at the nose, or like pay attention to the nose. Thank you very much. And now we use that term, nasal hygiene. Please educate us. What do you think about nasal hygiene and what should be done?
Okay, so and first, if I may, I just wanted to speak about how important the nose is. We already touched on it, but there's some things that the nose does for us that the mouth does not, which is why it's important to observe good nasal hygiene. When we breathe through the nose, obviously, we're getting air into the lungs, but on top of that, the nose is actually humidifying the air, bringing it to the right temperature. The nose is also filtering the air, so it's keeping some pathogens out. And through the nose, our body also produces nitric oxide, which can help us also fight disease, or it helps with our immune system. So because the nose also breathing through the nose also keeps a good balance of oxygen and carbon dioxide, which we need also for many things, including our nervous system response, as you mentioned earlier. For that reason, we want to keep the nose in really good shape. I mean, if it is that important, you want to observe nasal hygiene. So nasal hygiene is basically habits that you should have to keep your nose clean, clear, uncongested, patent, open, and moisturized or humidified, right? And that's how we sort of keep our nose tuned up so that it does all these other functions for us. Is that, did you want
Yes,
to
it's a wonderful. I really like how you put it, tune up. So to have a tuned up nose, I would like to ask you, how do you keep a patency, like nose being open? Of course, we know all about the danger of congestion in the nose. Then sinuses are closed, people open the mouth, breathe with the mouth, they get through a lot of sinus infection, turbinate enlarged, and people talk about deviated septum, and I can say I'm a queen of deviated septum. My septum is very deviated. Please educate us. Now I use mute a lot in my practice. I'm offering that to my patients, and I think it's such a great product, and it's really for people who suffer from snoring. I know people don't say they suffer from snoring, but the partners suffer from snoring, but people suffer from snoring. Yes, the body suffer, and sleep apnea and upper airway resistance, all these hot topics that can affect longevity and I would say fulfillment of the life in general, health, and leads to some chronic disease, so many important factors, but I think mute can improve it. So please talk about what's so special. There are a lot of nose phones on the market, but what's so special about mute would, take a special place in my heart.
Oh, well, I appreciate that. Thank you very much. We're very proud of our product. And so Mute is an internal nasal dilator, right? So, and actually what I'm going to do is um, get rid of this background for a little bit because it makes things a little fuzzy. So
We want to know Mute very well.
give me 1 second and I will, you'll see my green screen. But it's an internal nasal dilator and it comes 3 to a pack and it comes in different sizes. So there's a small, a medium, a large. They come in different colors. And then there's a trial pack that has a small, medium, and large in it. Now, what it does is it supports the nose from the inside and pushes out. And it allows people to get 38% more air by just putting it in their nose.
This is amazing.
Yes, it's nice because it is actually very discreet. It's small, unobtrusive. It doesn't have any, there's no adhesive that might make your skin sensitive, that you might have sensitivity to. And you can put it in, and I'm going to do this on camera, although I normally do not do this on camera in front of people, but you can just put it in very quick, very easily. And
yeah, it's not visible at all.
And it goes. It's discreet enough. I've worn it in the daytime. I've worn it, and if I'm not going, not too many people are asking me for photo shoots. And so otherwise, I have no embarrassment in wearing it in front of people. It is, you mentioned COVID and masks. And one of the things that we were trying to make people aware of is you can wear Mute under masks because if you have weak nasal valve,
right,
you have very thin nostrils, it's very possible that the mask is actually pushing down on your nostrils. And if it does, what a lot of people are doing is mouth breathing under the mask. So we're trying to keep from getting sick, but then we're also shutting down the avenue that's actually designed to prevent us from doing that, right? We're shutting the nitric oxide and the filters are in the nose, but now we're bypassing the nose and breathing through the mouth. So Mute under a mask actually helps you to be able to breathe better under the mask. It is adjustable, and I will.
This is wonderful feature because not every size fits all. We know that.
Right, correct. So the nice thing about Mute is, and perhaps you can see, it's got sort of a little ratcheting mechanism right there that you can pull apart. And now perhaps you can see how one side is open and bigger than the other side.
That's my story.
You mentioned deviated septum. When somebody has a deviated septum, they will have one nostril more open and one more closed. And it may be very uncomfortable to use a one size for both sides.
Yeah, I absolutely agree with that because it's totally different sizes.
So this way you can adjust it. Each size is adjustable. You can adjust the small and it will open up to almost the size of a medium, and the medium can open up to almost the size of a large, and the large can also open. Wow. So you can adjust it for your comfort. And again, it is to help people with nasal valve collapse. I have friends that when they speak, when they breathe, I can see their nose going.
Yeah. They close the nostrils. Yes. Yes.
So those are people that are not getting enough air when they breathe. There are people that I speak to on the phone that I can hear them when they're talking on the phone and they sort of sound like this, a little bit, and you can hear at the end of each sentence where they take a gasp, and it's just a lot more audible over the phone because they're doing it through their mouth.
Of course.
So those are people that also can be helped by Mute. If you have a deviated septum, of course, one is going to be side is smaller than the other, so you can open them both up. And we're talking about daytime breathing because we breathe all the time, but at night, especially when you lay down, because of the way certain muscles relax, if you have a nasal valve collapse, it's more obvious to you at night because you begin to snore. And Mute is not, and I just want to make sure that we're clear, Mute is not have an indication for sleep apnea. Sleep apnea is a serious disease that needs to be treated with a healthcare professional that's trained to do so. But a lot of people that have apnea discover it how? Well, because of the snoring, because their partner's telling them they're snoring.
Absolutely.
And, so Mute can be the first level for you to, it's drug-free, non-invasive, affordable. So if you're snoring, try Mute and see if that helps your problem. And if you need to go further because you have a severe apnea, Well, then there's other places, you can go see your airway or sleep dentist. You can go see your ENT. You can go see wherever you need to go for that. Mm-hmm.
I also have a question regarding, I know your company have a product for athletes or for people who do sport. Because of course, even if you do sport, we don't want you to open the mouth and breathe through the mouth. A lot of people do that. And please talk about, what inspired your company to do the daytime nasal dilators.
Yes. So we have another product called Turbine, and it's a very similar architecture. If you hold them side by side, you might notice some difference in the angle of the horizontal paddles, just a little difference, because it's designed to stay in better when you're upright, right? Mute is more for when you're lying down, Turbine is more for when you're upright, and when you're kind of pounding, running, cycling. And there are definitely, sometimes you can see at the end of marathons and other cycling races, people wearing the Turbine. So many times when I recommend Mute or Turbine to people who I know who are runners, they'll go out and they'll say, oh, I'll try it tomorrow. And they'll go out and run, and they come back and they say, wow, I felt so much better. I felt like I had so much more energy. And I've got friends that check their VO2 max and they say, oh, my numbers were better. It stands to reason that if you're getting more air through the nose, and if you're able to keep your mouth closed, well, this should help you to feel more comfortable when you're exercising. This should help you to get the right type of breathing going when you're exercising. When I was in school, I was taught that when you're exercising, you should breathe in through your nose and out through your mouth, and in through your nose and out through your mouth. But that's no longer what they're teaching. That was, 40 years ago, that's what my gym teacher taught me. But if you read the literature now, no, we should be breathing through the nose most of the time.
Yes.
So you need to have your nose patent in order to be able to do that. And that's where Turbine helps. It's a good question that you asked. James Nestor wrote a book called Breathe, a very,
my
very
favorite book. I have it as well right here.
A very good book. And there he talks about, James Nestor went above and beyond because he actually did experimentation on himself. He and a friend plugged their noses for a couple of weeks and got all their numbers and their, stats and blood pressure and other things. And then before and while they plugged their noses and after, and you could see how everything just gets so much worse and then gets better when they can breathe through their nose again. But he mentions a Dr. John Douillard, it's French, and an experiment he did where basically with elite athletes, where basically he had them get on stationary bikes and started increasing the resistance progressively. And one time he had them, was recording their heart rate, their breathing rate, and other things while they were only breathing through their mouth, and then he did it again while they were only breathing through their nose. And the interesting thing is that some of these elite athletes, when they were breathing through their mouth, they were breathing 47 times a minute at a certain resistance level, which is 200 watts on the machine. But when they were breathing through their nose, they were doing the same effort, exerting themselves the same way, at only breathing 14 times a minute. So if you're an athlete and you can, run or cycle and do it breathing 47 or 14 times, which one would you rather do?
Of course, you want to spend less energy on that.
Exactly. And Patrick McEwen, this is another very, very, very good book.
Yes, we love Patrick.
He mentions the same, Dr. John Douillard, and he also mentions, this book really goes into the weeds, explaining the biochemistry of breathing, the biomechanics of breathing, and giving you a lot of exercises so that you can take care of your wellness with breathing, the parts that can be affected by breathing, how to do that. So those are some very, very good books if anybody wanted to just get more information.
Oh, thank you very much for mentioning that. That's so great, it's kind of expand the horizons.
Yes. So absolutely, we have a daytime product. Now, people can use Mute in the daytime. They can use Mute at night. It's all, sometimes it's just a matter of preference, but definitely it is something that can help to, it can help, one mute can help two people, because if it helps the snorer to reduce snoring, the snoring partner is also very grateful. And
Yes.
I get testimonials probably weekly, emails that come in. Some of them are like, you have saved my marriage. My wife has let me back into the bedroom, or my wife came back into the bedroom because she just had enough and she left. You know, they're some of them are touching. We got a testimonial from a lady who had a form of cancer, and most of her nose was either eaten away or cut away, and she had very, very thin flaps that would not stay patent. So she managed somehow to use mute in conjunction with her nasal cannula, and she says that's the only way that she could breathe. So the idea is, again, to keep the nose open so that it can do its job.
Absolutely. I think that's really a big thing. Now I'm going to ask you the last question, very personal. Please tell us about your nasal hygiene routine, because I think the hardest thing, you know, to make it your own, to have that sequence that's comfortable, and you do it and you can incorporate it on an everyday basis. Please give us your professional advice on your nasal hygiene routine.
Okay, so I will tell you what I do, and it may not work for everybody. Some variation of it will work for different people. I don't have a deviated septum or nasal valve collapse. However, during allergy season, mute helps to keep my nose open. So when there's extra congestion, I put it on, I wear it. Another thing that I do is I use very regularly neti pots. This is my older one, my old sort of beat up veteran one. And then at one of the last conferences, one of the reps from the company told me, you know, you really should go to the bottle. So I use the bottle now. I also, because remember, nasal hygiene is about keeping it patent, clean, and clear. So the other thing I use, and I wish I had some right here, but I have some that is coming on its way, is the clear spray. And clear is spelled X-L-E-A-R. And I assume the X is for xylitol. So that's one of the main ingredients in that spray. And they have a lot of information, clinical data on their website for the value of xylitol and how it has some anti-inflammatory properties, and it also helps with helping so that bacteria does not adhere to cells. So it actually helps to fight things off. But that it's a nasal spray. It comes in a spray with xylitol. They also have, which is what I've been doing more recently, so I don't spray and also neti pot. They actually have a xylitol saline packs.
Wonderful.
So I use those packs in my neti bottle. And when allergy season is really bad, where I live here, where I can go through a period of headaches that last for days, I will do it 3 times a day. When I get up in the morning, when I get home from work, when I'm done working, and before I go to bed. And when allergy season has passed, then I try to at least do it daily or twice a day. That's my personal nasal hygiene.
This is wonderful advice. We really appreciate your time and all this, useful information. And I'm gonna suggest I'm gonna put your nasal hygiene in our box underneath this interview, and people can follow your advice, because I absolutely like what you do. I think it's really promote good night sleep, good night breathing, and good breathing during the day, which is very important for overall health. Also, I will put a special link where people can get in touch with your company and order, or do it from Amazon, do the mute. And I want to say my part about mute. I absolutely like the idea what you can adjust, and it's very soft. And I personally tried, and you absolutely don't feel it, and the breathing become seamless, like you don't hear. It's not a loud breathing, which is very rewarding, for the person and for the partner. Yes, it saves love and marriage. The sleep is a very intimate story. Thank you very much, Mr. Bulkarsi. We're really honored to have you here with us in our community, and we're looking forward to talk to you again.
Well, thank you. Thank you for having me. Bye-bye.
Today, we have a pleasure to interview Mr. Ivan